Morning guys, I want to have a quick chat this morning about the difference between treatment and wellness within physiotherapy. So treatment is a technique that is aimed at a pathology. So I've sprained my ankle, therefore I aim my treatment at the lateral ligament, for example. Whereas wellness would simply be making the patient feel better. And it's often the case, particularly on social media, that anything which is to do with wellness is a little bit demonized. You know, the argument is always, oh, well, that belongs into the spa. There's no place for that in the treatment room. And that would include things such as hands-on technique, massage, manipulations, mobilizations, for example. However, I would argue to you that both treatment and wellness are present in most interactions that we have with patients and are important in most treatments. So if we take a sidestep and say, well, what is the model that we're working on? Nowadays we differentiate between the medical model and the biopsychosocial model. So the medical model is very much based on a structure. So I'm aiming my treatment at a structure. For example, I'm manipulating a particular joint, I'm massaging, I'm releasing a particular tissue. Now that is based on, as the name would suggest, a medical model of surgery where something hurts, I can treat it with a tablet or I can cut it out. The biopsychosocial model draws on that and says, well, biology is clearly important, so structure is clearly important, but also the psychology, how that person reacts to that injury, the fear of movement, for example, and also the sociology, how that person interacts with others and how their sprained ankle affects them into their day-to-day working, for example. And I think with most treatments, when we assume that we are affecting a specific tissue, it's probably the interaction of the treatment, the so-called therapeutic alliance between the therapist and the patient, which is a lot to do with the result. So if we take an example of a soft tissue procedure on the ankle, we may assume that we're doing treatment, but we know that the procedures that we use are not really powerful enough to directly affect that tissue, and they don't go deep enough to affect that tissue. So any benefit which is coming from that treatment is likely through the interaction with the patient. We're making them feel more confident. We're giving them permission to be in pain. We're reassuring them that there isn't a direct relationship between the pain that they're suffering and their condition, so-called hurt and harm paradox. So, we are assuming that we're performing a treatment, when in actual fact we are more performing a wellness technique. If we look at a technique such as exercise, which has become, you know, the go-to technique with most forms of treatment, and the argument is often, well, you should be exercising, you shouldn't be doing a manual technique or something which causes the patient to be reliant on you. But when we look at the evidence, when we look at the research, for example, in chronic low back pain, we know that exercise is the treatment which is of benefit. However, when we look at what is happening to that patient, it's not the musculoskeletal change, the alteration in strength, the alteration in flexibility, aerobic fitness, for example. It's not that change which is responsible for their improvement, for their reduction in disability. It is simply the act of undergoing an exercise, taking part in that exercise and enhancing self-efficacy rather than any physical change. So all exercise will be of benefit, and no one exercise is necessarily better than another. What we have to do is to be patient-specific. So again, you know, would it be better to go into that gym and say, well, you know, we really need to be specific with this exercise, we're doing this particular technique in this particular way, or should we simply say to the patient, well, just go off and do a walk because you haven't got access to a gym, there's not one in your area, you can't afford to go to a private gym, but you do have a road outside your house so you can go and walk. So that approach again is targeting wellness rather than a specific structure in the back, the disc, the facet joint, etc. So we can argue that actually the improvement is wellness in that case as well. So let's not demonize wellness and say that it is something which is only appropriate for the spa. Let's admit that we are taking a biopsychosocial approach to treatment, and the treatment technique and the wellness, the improvement in that patient's overall well-being is equally important. And I am okay with performing a technique on a patient where I know that I'm only enhancing their wellness. That sits well with me because I know that many of my treatments will be doing that anyway, whatever my belief. All right, thanks for watching.